Okay, we're
All right.
rolling. Yay. Okay, so but before I kind of jump into this, first of all, thanks everybody for coming. Nice little group. I guess everybody's got a little extra free time on the planet. It's kind of an interesting concept, but we have a common interest here, and that is how do we help people as well as possible, and help them with the structure of the body that we know as posture. And it's complicated. I don't know all of you that are on here, but I've been doing this for about 24 years, and it just gets more complicated. It does, and it's not that it doesn't. I shouldn't say it that way, like there's more that I scratch my head about, but there's just more to think about. There's so many variables in the human body, and unfortunately, it's been minimized. Okay, and I kind of went to great lengths to try to help people and to be good at um, what I said I was doing. And for myself, and I'm speaking from my direct experience, um, that dream didn't show up, and that promise didn't show up. So I started asking some questions about how to do a better job, and it's taken me um, man, down an amazing path that I just asked a simple question at one point was, my first question was, how do I take an anterior atlas, because I was an upper cervical dude, and how do I take an anterior atlas and turn a posterior pelvis on the same side? And being an engineer, not just in my schooling, but in my heart, um, that was a big task because an atlas probably weighs an ounce or two, a few ounces, and a pelvis weighs many pounds. So there's a law in physics that big things move little things, not little things move big things. So I started, asking those questions. And tonight's conversation has taken me um, away from the model that chiropractic teaches. Okay, and that is that we are a bone out of place. And it's not that that's not true, because that's 100% true. It's just not true enough. And that goes for everything that I'll say for you tonight as well. It's just not true enough. Okay. So there are things that the outside of chiropractic are looking at. They look at human posture. And the reality is that we are not just a bunch of bones. We're an expanding system, like a balloon with a bony system inside. Okay, so that makes life interesting, and then it's kind of funky that we actually have this big balloon. It's kind of from the pelvis up to the shoulders, and if you just look at um, the human body for just you look at those pictures for just a moment, especially that X-ray, how is that thing doing what it's doing, and how is it maintaining itself? All right, these are great questions. Is what happened to it? And then to say, hey man, it's not just had trauma inside it, it's had some type of it's an alive system. It's got life in it. It's not a building, it's not a bone out of place. It's a traumatized system that actually reacts. Okay? And you can't have just a simple little linear model that explains that, or a bone that explains that. I'm sorry. You know? So we're not the only ones that do that, by the way. Everyone else does that in every other profession. So if you have a shoulder problem, everybody, the orthopedist would look at the shoulder, the PT would look at the shoulder, the massage therapist looks at the shoulder, the chiropractor would look at the shoulder. A lot of people would look at the spine. I got that, okay? But they would look at the shoulder, okay? So that's not a shoulder. It's got a story to it. And I started asking questions and looking at things and noticing stuff um, to help me do a better job for my patients. And that's what we're going to talk about tonight. And it's interesting because if you look at the X-ray and you look at the bottom, just look how the ilium or the width of them, or look at the rotation in that thing. And then look above that and see how the spine is tilting and how the pelvis is dropping down on the left. And if you climb and you rise and you get just above the stomach and the gastric air bubble, you see all of a sudden there's a recovery where the middle of the lower thoracic starting to bend towards the right. And then everything is really nice and straight. And if you could expand that picture, you'll see that the shoulder tips down on the right, neck tips to the right, and the head tips to the right. And in QSM3, if you look below that picture, that's what we call a postural listing. If you haven't been on before, I don't recognize a couple of you. And that describes that picture's relationship of the pelvis, the spine, the weight deviation, the tilt of the shoulders, neck, and head. And it also describes the configuration and the twist. So I'm not going to get into that tonight, but that's what that is below. And I'm going to ask you guys again if you could turn your microphone off. Okay. And that way, if you got a question, you can just turn it back on. Andy, thank you. Perfect. All right. So this gentleman right here, just to give you a little history, he flew in, and I saw him about 3 weeks ago. He flew in from, I think it was Washington, D.C., Virginia area. And he just called me up. He was referred to me by a patient that I used to see here. Anyway, the guy came and he sent me that picture. I asked him to send me a picture of his posture. And the picture of him there is him in his underwear. I told him I've never had anybody send me a picture in their underwear. I put those lines on it and sent that back to him. And I said, you could see the trouble now. Okay. So what we see is the story that people come in of basically three things: is life's traumas, the compensation to those traumas, okay, and the energy of the way that human body is handling it. Okay. And that's an interesting concept, because if somebody is carrying a 5-pound suitcase or a 50-pound suitcase, as a chiropractor in posture, in weight deviation, I would like to know that. If the pelvis was tilting one way and the spine was tilting another way, and that was biomechanically not sound, and we're not here to discuss that, but I would want to know that, because otherwise I can't help, figure out that maze. And then the last piece is I would like to know how that person is handling it. All right. Meaning, are they carrying what they have and they're just hopping along, or are things breaking down? So we can do that in QSM3 right now and have some conversation about that. And there's a story to this picture that goes on here. The big thing that I want you to see right now is that it's not an X-ray and it's not just those couple lines. This is a three-dimensional picture that is twisting and turning, traumatized and compensating. And the questions are what are normals? Okay, is it reacting normally? Okay, if you haven't been here before, the answer, and if you've been in chiropractic and you look at somebody, what is the neck supposed to be doing, and is that shoulder in the right place, and is the pelvis, and instead of, wow, look at that turn in the pelvis and the tilt and the degeneration and this kind of stuff, is how do we put together the whole story of this thing so that we can help it, okay? And that's understanding some of the normal biomechanics of the human body, which, again, we're not going to talk about tonight. We're going to talk about Tensegral Biomechanics. But what happens is this thing goes into distress. And instead of a big bouncing ball, it has to lock up, otherwise it's going to fall over. And that's what you see as the thoracics are trying to pull over to right. Otherwise, this guy's going to fall over to the left, okay, at 40 pounds on the left-hand side. Okay, so he's got to engage all these right muscles. And what happens is that thing starts bending and twisting, and over time it starts collapsing. And we start noticing as patients ourselves, and as doctors, we hear it, people coming in with some type of degeneration from that. It starts with muscle spasms. It starts with then the joints are breaking down, and then multiple muscle spasms, and then the body keeps collapsing, and blood pressure goes up, and neurology issues, and organ failure, and death. Okay, there's just no doubt. Okay, so that lock that this person is having at 40 pounds off, and these that postural listing down below the X-ray, is it locks up, and it is our job to try to free that lock. Okay, that is really the fundamental statement that I see that we need to do in chiropractic. And that lock is, if it's not overcome to some sustainable place, because the human body has a kind of a grace space, obviously, that we can, this guy in this kind of position, he's not going to become a pencil. Look at that pelvis. I mean, that twist in that pelvis is not it's not something that I'm going to adjust him and it's going to come to zero and he's going to live a life of a pencil. It's not going to happen. But there's a place in the parameters that people can live in that it doesn't get overloaded energetically, it doesn't get overloaded fascially and structurally, it doesn't get overloaded in the joint system, it doesn't get overloaded in all its systems, okay? And that's a space where we live, and that's where, I've had multiple surgeries on joints in my body, but I'm sitting here comfortably right now, okay? Thank God. Okay, so we can do that. To do that, we need to overcome this lock, and to overcome this lock that's three-dimensional, we need to be able to have structures that are right side and left side. Look, you got a left low hip, but you got a right low shoulder. So how do you plan on moving two things in an opposite direction? And if you look at the sinuses, if you decide that you want to open this up, you'll see some of the sinuses are right and some of the sinuses are a little left, which means globally I can measure this, but locally there are things going all over the place. If there's rights, there's lefts. Otherwise it would fall over. Okay? If there's forwards, there's backwards. If there's ups, there's downs. All 6 planes of motion are being covered by this thing right here. And we have been given the task of changing that. So how do you make something go that you push right? How do you make it go how does it not disrupt the thing that's going left, and so forth and so on? Okay, and that's kind of the space that I live in now, is looking at the postural listing, looking at the structure itself, and there's basically 3 levels to understanding this postural listing. There's a way that I would release it that I would tell you at a module 1 level, and that would say, okay, do it as an algorithm, and do this, do this, do this. And then there's a level module 2 that I said, okay, from my experience, I see in this listing such and such and such, based on my experience, and there's weaknesses in here, and I want to address that weakness first, okay? From my experience, I chime in. So the first one is just, here's the combination, try the combination. The next step is, hey, here's my experience. And the third one is, when you use number 2, is what is the patient, how does the patient respond? So now you have 3 things that go into it, okay? And we're going to talk about some of those levels tonight. So if you're here for the first time, don't freak out. I'm really in these webinars, I try to give more concept rather than detail. Detail is for the classes, okay? So I like to open up new thoughts for you to look at patients, their x-rays, their posture, however you're looking at them, and asking questions and trying to figure out how to help them better. Because the name of the game is, how do you get this thing unwound and up and open and lift it back up? All right, so what is the kind of the path through the maze? And then what is the weak link, and how do you support that first and foremost, so it could stay upright? And that's called stability. All right, so you got to ask these questions of what's going on with this thing so that we can kind of move ourselves forward that way. Okay. Oops. Any questions? Um, okay, so the first thing in Tensegral Biomechanics is that we're not a building, okay? We're a balloon. And balloons don't behave like buildings, and buildings don't behave like balloons. You see the lady on the left-hand side, she could push the Tower of Pisa, and no matter where she is, I don't care if she's an inch from the floor or all the way at the top of the roof, the forces are going to be moving, in one direction. Okay? All right. That doesn't mean if you pushed it from the bottom, it'd be the best place to push it, though, because of leverage. All right. However, wherever she pushes, and that's called in physics a rigid body. All right. And that's basically the way chiropractic teaches us to adjust. Here's the bone. Here's the place that we document it, and here's the place we're going to push it. If it's P, we push it P to A. If it's I to S, if it's inferior, we push it I to S. Simple. Okay. Well, that's great if we were just that one piece. But like I said, a human body is three-dimensional and the distortion is three-dimensional in all six planes of motion. Okay, not just one plane of motion, as well up and down. So an elastic system doesn't behave that way. A balloon system doesn't behave that way. Here's a balloon right here, and the person is pushing in with, let's call that just a dowel. They're pushing in, and all the forces are moving to it. So it doesn't matter if it's on the right side or the left side, all the forces are moving to it, which is great because that is the way that we're going to help adjust different people. If you're on the right side and you have left structures, that you're able to bring those structures as well to you. If you're anterior, you could bring it posterior. If you're up, you can bring it down and up and so forth and so on. Okay, because balloon, you guys know this. What I'm talking about is as you push in, you feel that tension pull to you. It doesn't matter where it is. All three dimensions. All three dimensions approach that. Okay. So the anatomy and physiology of the human body is we just need to apply this, and that's what we're going to do here on this next slide. Okay. So here is a balloon. Okay, and I use the neck, and the reason I use the neck is it's a multifold place. Number one is if you want to bring things, and we have an elastic system, and you want to bring things to the elastic system, I mean, completely to everything, and you want to raise everything because the rule in gravity is things are always falling down. Okay, so everything falls down. We see that in grandma. So we use the neck because it's the highest point. Why don't we use the skull? Simple, because the skull is hard. Okay, you can't push into the balloon there. But the head, if it was like the neck and it was soft, okay, then guess what would happen? So, the head is kind of the opposite. It's got a hard structure, and the hard structure in the neck is all the way deep. It's the spine. So we've got soft stuff that we can push into, okay? And we could push into the balloon. So the neck is, the next best thing, right? So the neck, it doesn't matter where you push. If you push here, up at C1, C5, or C7, everything is rising. Everything is rising in a balloon system. Everything's coming to a place where you push. If you push here, okay, the back comes this way, the front goes this way, the top goes this way, all this goes that way. Everything comes to that point. Okay, that's an elastic system. All right, so you could say, hey, we could just be like, D.D. Palmer and just, smash them in the back and everything will just go. Okay, well, that's not the case. And the reason it's not the case for us to be able to do that is because there's been damage. And some of the lines aren't connected well. That's number one. Number two is because the connections for the body is it's not just a clear latex balloon that everything is smooth. We have muscles within there, and they connect at different places. And places like at C7 here have different connections than, say, C5 and C1. Right? So this area down here has direct attachments for these muscles down here, for the postural muscles. Okay, this area up through here, okay, is more of an area that's for the head and neck. All right, so if I want direct access, and this is what I found and deviated me away from C1, is that I was really good at affecting trouble up here in the head and neck as an upper cervical doctor, but I had trouble dealing with low back issues and lower structural issues. And when I started releasing this area down here, I did a whole lot better. And it's still that way. Okay. So bad connections and also the insertion points themselves are important. So I use the whole neck. All right. That being said, is the neck is also a great place because it's supple, but it also is three-dimensional. And 3 dimensions is the game. All right. So we have this fantastic area up top that we can access tension every single direction, which is what you have to do, because if you look at somebody, there's every plane of motion, and you got to be able to get motion to get those tension lines to stretch and open them up. All right. So I started looking at not just the direct attachments up in the neck, but also at innate intelligence. I like looking at innate intelligence. It was a day that I didn't just say, wow, the C7 TP, spinous is the biggest spinous. Wow, okay. And that's got a special name for it called the VP, which is this. It's all cool language, but there's a reason for it. I mean, universal intelligence makes innate intelligence. If there's something that's big, there's a reason for it. So again, not for tonight's class, but those access points are big accesses, okay? The spinous on C7 is a huge access for rotation. All right. So those areas have to be released and overcome, and we feel that tension that's there. And we overcome that tension. And I'm trying to get. All right. Okay. All right. So anywhere we touch up in the neck was the last slide. We pull everything upward. Okay, different areas are better access points. C7 is an access point for the posture. But the other piece here that we add to the puzzle is we're not just a balloon, we're a balloon with a big counterweight on it. Okay, and that works to our advantage, and that's what upper cervical does a lot of the times when it wants to say open up the acute angle between the neck and the atlas. Is it'll drop that head out and create that tension there. It doesn't just use a low line of drive. Okay. So that's great stuff, okay? And that's important stuff. So the head is used and can be used, so not just to deal with the top that you're dealing with. Like I used to look at it is, oh, I want to create tension in that neck and open up that lower angle. That is 100% true. But at the same time, what also is true is that it also can be used in the opposite way. So if you look at the middle picture here, this one, you'll see that if I just keep the head level and I push into the neck, I'm going to basically get equal action from here on this side of the neck or from this side of the body, and the side that's up and the side that's down. Okay. If I drop the head like in this one, number one, I can increase the tension here. And why would that be important for me? It'd be important for me because I have a postural listing, and if I have the right side up, and that's the side that's got, he's got 20 pounds on that side, or all his structures are on that side, the postural side, shoulders low on that side, his spine is low on that side, it's tilting to that side, everything has shortened on that side. I need to expand that tension line. I can do that right here, but I can also drop the head out to help me create that counterweight. Okay? And it's important. Why do we even have to have this conversation? Why can't, hey, Russell, why can't I just go ahead right into here at G7 and just blast this guy a few times over here, and off I go. And the reason is you don't have enough power. Okay, because the lock of the human body three-dimensionally, it takes a low table, it takes a whole lot of finesse. So if we can understand how to access these lines and get the body in kind of a preset position, and then we lean into it, then we don't have to kill ourselves all day long, because I get worn out. Okay, it is a lot of work, and if you have felt necks and you get a guy on the table and they're locked up, I mean, every one of you has put your piezoform on a neck and you go, oh brother, I'm gonna die. Have to do this to get this thing open. Okay. So understanding these mechanics of how the tensegrity works and using the gifts of the body that are around us as levers and counterweights and these kind of things, it's going to be very beneficial for you. Okay. So if you understand what you're trying to do, so let's assume, all right, here's a great example. I've got somebody that has all their posture listing is all rights, okay? And I have them laying left side up, right here. Let's not get into the conversation of why I have them left side up, right? So if I've got the right is all short, which side do I want to access? And I've got the left side up, like in this picture here on the bottom. I want to create tension on that bottom line. So I can create on the headpiece an angle like this, come into the neck, okay, and create a whole lot of tension to bring this thing all the way up and around. And overcome, even though I'm on the opposite side, overcome this right here, this tension. And by the way, just to let you know, if you flip the person over, which side do you think is your most powerful side? This one right here, not the one on the side that you're on. And the reason for that is look at that head. You get to roll that thing. It's an angular, it's like a crowbar, only round. It's called angular momentum. So using the head gives you, I don't even know I don't know the physics number, but it's got to be at least 10 times to the power for you. And that's important.
You're saying the bottom picture is more powerful for us?
The bottom picture is more powerful if you can do it right. Okay. I mean, you got to learn how to do this. Okay. You have to learn how to turn the head. You can't just go in and buckle the neck. Okay. You have to go in and turn the head. And we're going to talk about some of that tonight. But understanding that number 3 is really your strongest position, because a lot of people, you just don't have enough power to overcome that right side on its own. You know, you just can't do it. So this side is the easier side because it's the long side, first of all. Okay, the short side, like if it's all rights and I have the left side up, overcoming all that is, you'll be pushing all day long. So starting on the left side to just kind of break this thing loose and using the head is to me crucial. But you got to know how to do that. Okay, and the details are you know, the devil's in the details, you know. So this gives you huge leverage and ability to increase the tensegrity. Listen, the whole idea is we got tired and lost air, and we need to expand the human body back up to center. Go look at your grandma. It's simple. Everybody's breaking down. We just got to look at posture three-dimensionally, understand it. Okay, so the head and using it as a counterweight, and you know, it's like a, you know, if you put a cue ball in a sock, and then you turn the cue ball, and you know, you would be able to pull the sock in multiple directions. That's what I do. I don't just go up and down. I'm going three-dimensional with it all the way. Okay, that head's my pal.
Question?
Yes.
On the bottom one, are you saying?
Hi, Brad.
Hello, Russell. On the bottom picture, are you saying that? I think you remember the neck can take that even if it looks like you're going downward motion, which would stress out that head.
Okay, so that's a mod 3 question.
Okay.
So a mod 1 question would be, I need to show you exactly how to do that. The mod, okay, in the spot, okay, and only touch this spot. The mod 2 question becomes, here's the line of drive in that spot. And the mod 3 question is, if you know what you're doing, you touch everybody everywhere in the correct line of drive, stay within the path, and bend that head all the way out of that thing and overcome the whole other side in one shot. Okay, Brad?
Yes, thank you.
Mm-hmm. All right. Okay, so that's the head. Okay, but we don't just do that with the head. We brace the head. We brace it, right? We have it on a headpiece, okay? Because otherwise the head would just be flopping around, okay? So what we do is we create these huge stable structures on either side, the head and the shoulders, and look what we're able to do to the head, to the neck. We're able to create a very stable, okay, sustained line of drive because people are not wobbling all over the place. Follow me? So by bracing somebody, okay, and stabilizing the head and shoulders, you were able to create a very specific line of drive because you have two stable structures. I mean, so you basically get in there with your pinky, okay, I use my piezoform, and you could poke here and poke there and be very surgical about it, okay? That's a great thing about bracing the head. The other thing that it does is it creates an ability to create distance. And why do we want to create distance? Okay, why do we want to be able to create depth and change like that and bending like that? Somebody tell me.
To overcome the lock.
To overcome the lock, exactly, is that you guys, this is what I tell patients, okay? I have to take you further than where you are. Okay? So if you have a person that you have a cast on your arm, if you had a broken arm before, if you haven't, just imagine it. You take the cast off, you just don't go yank, okay, to the arm, and off it goes to its full extension. Okay? So you have to be able to go very specific and open and open and open, and you have to take people beyond where they are. Some people you can take them to full range of motion, okay? But you have to be able to overcome the lock, and you have to be able to take the rubber band, the fascia that's shortened, to its end point, okay? And that end point will keep changing, 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 changing. Okay, what do I mean by that? Is because just like an arm, I move it, and then it moves, and then it moves, and then it moves, and eventually it gets to a place where it's completely released. Okay, that's what we call is somebody that's open. All right, and the challenge is to try to get patients there as fast as possible. Some people you can do that in one visit. Some people you can never do it. Okay, they're just too locked up. They won't let go. Okay, but there's things, and these are things for the conference to show you how to do those things. Okay. So anyway, we can push into this thing, and by bracing this guy over here, we create this long span, okay, in a very short area, stable between two objects, okay, and allows us to create a very, very specific downward motion. And if I did this motion over here, it would do something very different versus this motion over here. It would do something very different to that tension in that system. Just dig your finger into a balloon and move it to the right, move it to the left, move it up, move it down, and twist it. You're going to create different tension and different pulling. That's what we're going to do with the human body. So the better we understand the three dimensions of the human body and what's happening, translates then into the action of our piezoform and the way that we pull that tension. And that's all I'm doing in my mind all day long is finding those tension lines and releasing them. The more I release them, guess what? When you release all the tension lines, what do you have? You got a full tire. Okay, that's what happens. It's that simple. Gold. Okay. All right, so we got a balloon. Everything comes to it because it's an elastic system. We have places that when we push in the cervicals, we use that cervical area for its three-dimensionality, okay? Its ability to be braced and have depth. It's the highest point that we can get depth into. But that thing also has, that balloon has articulations inside it. So we can't just twist it and turn it every which way. because nobody likes getting their finger bent backwards. Okay, so you got to be able to stay in joint ranges of motion. All right, so I can tell you that when I put my hand here, change the color. When I put my hand here on C7, you guys see that? Can you guys see that?
Yes, there's blue and yellow and
Okay,
black.
fine, as long as you can see it. Okay. Or if I put my hand here, okay, coming down on the TP, or an SP here, or a sinus here, there's different ranges of motion in there, yes? Okay, you need to get extremely acquainted with these 8 piano keys that you play with and their motion. Okay, and you got to be able to feel that. And you got to feel what they're attached to. If you notice, you'll see there's some like muscle lines in here, these lines that are here and lines that are here and so forth and so on. Okay, well, there's different attachments. So not everything is the same in there. So you need to be able to feel those things, come into those things, and then move those things through a path to follow them, to take them to their furthest point. Okay? You guys understand what I'm saying?
Yes.
Okay, because it's like, there's a range of motion to these articulations. Okay? And it's not that they're one-dimensional. You have to free them in all their dimensions. Okay? Because when they're all free, it means everything else is free. Okay? That expression, as is below is as is above. And the opposite of it. Okay? So it has insertions. So around C7 in the traps feel very different than up at the atlas or at the C2 spinous or at C5, which is, a big bend point right in the center of the whole thing. This is a huge, C5. It's the biggest collapse point. Right? It's right in the center of the bridge. So everything has different motions. You need to be able to feel those pathways, those articulations. Right? It's complicated, man. Keep going the wrong way. Okay. Okay, so let me tell you what, at a nice, easy level, I'm going to kind of talk to you about a case right here, just a little bit. So there are in the neck 2 main bend points, okay? And they're either call it C0, C1, that articulation, and the other articulation, you could call it C7, T1, okay? And those 2 articulations do very different things, okay? And they also do the same things, okay? So when I push on C7, it does everything. It pulls all the postural muscles from below. Okay, I told you that. It is the #1 insertion for the postural muscles. If you want to change pelvises, spines, shoulders, weight, C7's your go-to guy. Okay, everything pulls upward, both sides. Okay. You can push on C1 and get a whole lot of activity because it's also doing the same, but it's higher up, okay? But you're not getting the same leverage up at C1 that you're able to get at C7, okay? So what I found is if I want to release things below, C7 is the best point, okay? So I adjust everybody and I start everybody in this area. It's got the most amount of fascia there, so you can hook on. It's got the most. It's supple there a lot of the times. So patients that are tight, and in everywhere else, like, you go and you go up on their TPs of C1, it feels like it's a rock there. Okay, everything's all locked up. You just got all these bones around it. There's no flexibility. Well, C7's not like that. It's got a lot of meat there, and you can get into that area and get down into C7 at some point, and it pulls everything up. Okay, but what I found is that there are better. These two bend points are, how do I want to put it? One is better for the neck, okay, than the other, depending on the side that you're on. So let's just let me show you what I'm talking about, and then we'll back up for a second because it's just a little, it's a little complicated. So this person that's laying on the table here in number one has got a right neck. Okay, this one over here has got a left neck. Now they're the same person. It's just one's left side up, and the other one's right side up. Okay, so this is left side up, and this is right side up here. Okay, so that being said, the neck is pointing upward on this point, meaning it's tilting to the right. Okay, follow me? So in this picture here, where would be the best point to adjust the neck and allow it to go right to left?
C1.
C1, yeah. Okay, so if this is the neck here, I'm going to put this line here. If this is my neck here in the top picture, C1 would be the best point to adjust it. All right, obviously, and vice versa. It's going to kill some of you guys, but got to start it at some point. Okay, let's go to a left neck. Okay, here's my left neck. Okay, do you see if I push it C1, how that's going to bend that downward? And it's already down. Can everybody see that? Chad, can you see that?
Yep.
Okay. That was Andy, though. Sounded you did a good impersonation.
I tried.
Okay, so you did good. All right, so here's kind of the rule, okay, at a Mod 1 level. If you have a coplanar neck, meaning a right side up with a right neck, your bend point is C1. Okay, and what that will do, and what that bend point allows you to do, is bring all the possible muscles up and also release the neck at the same time. Okay. If I had a left neck, okay, so in this case, my person is left side up, all right, and I need this person left side up. They got 40 pounds. So what do? I can't just go and whack it at C1 and bend his neck over and give him a headache. I got to know how to be able to get things moving in all different directions. Okay, so when I come into this point at C7, what is happening to the neck? The neck is coming around and lifting up. Okay, this is a Mod 2 conversation right here.
And that's right side up on that top one?
Which one were you talking about? Here,
Right side up with left neck. Is that what you're talking about on this one?
No, I'm talking about right side up with left neck. Yes.
Yes, thank you.
Yeah.
Hey, Russell,
Yes.
can you talk about what happens if you go straight down versus S to I in there?
Yeah. So we will in just a moment. I'm going to get to that at line of drive after this. Okay. I want to just get this concept here that people say. So what happens is with every patient, okay, a lot of them you need to adjust them on both sides. Okay. And the reason you need to adjust them on both sides is because they're damaged, and you can't get the balloon. The forces can't get through. Okay. Otherwise, it's just like in that first picture, you push, everything comes, and it's all good, but it doesn't work that way. It's not so simple. Okay. If it was, we would push anywhere in the body, and it would correct everything because we would just push into the balloon and expand the whole thing. That's not what's happening. Okay. Because there's damage, there's asymmetry, and there's lock inside that won't allow those forces to break free, and you have to work on them specifically. So you need to understand the articulations where they insert, And then if you listen, if you have something that's right, tilting to the right, okay, and you push it further to the right, the person isn't going to like that. All right, it's simple. All right. If I have a person that their spine is bent over to the left and I bend it further to the left, they're not going to like that at their L5 joint. Okay, they won't. So understanding how to go into the neck and keep forces moving together and all towards vertical is very simple. Okay, if you stay in the cervicals, all the postural muscles, everything below will come to you. You can't hurt those things. But you can hurt the neck, because if you have a neck that's tilting up, okay, if you have a neck like this, here's a neck, okay, and here's your shoulder, and I push into this thing here, I'm just going to buckle it further. So that's not good. I would want to push that up here and drive it down, so to speak, and release that tension line. So here's the rule. You have a coplanar neck. C1 is your bend point. It allows you to get their postural muscles on that side, bring everything upward because it's in the neck, and at the same time, it saves the neck. Okay, that is a MON 1 statement, because I adjust all the cervicals and make sure that they're free of motion. I'm going to get to that in just a moment, okay, if I can. If I have a neck that is not coplanar with the side up, meaning I have a right side up with a left neck, I have a left side up with a right neck, then C7 becomes my bend point. And that allows me to get the postural muscles, okay, and at the same time to protect the neck. And that looks like this, okay, this kind of thing, right here. So here is, let's call it a right side up with a left neck. The neck is bending sideways, okay, or to the opposite direction. So when I come in at C7 here, okay, because it's an elastic system, it pulls this upward to that, okay? That's what it does. Very simple, all right? So coplanar neck, C1, not coplanar neck, C7. All right, moving along. And then stretch. Okay, so I included this slide literally 15 minutes before I was going to do this, and because it's complicated. But I did want to show you the slide, is that in a Mod 2 level, you want to be able to adjust every joint and check it, but you also want to protect the neck. So this first one right here is a coplanar neck, okay? So C1 is, even though it's your bend point, let me change my color here. The yellow works. Here's my C1. No, that's not going to work. Here's C1 is my bend point here, but what do I want to do at C7? I want to clear that up because C7, I told you, has a very important aspect to it. It's my main line for my posture. So if I adjust this I to S at C7, and I adjust C6 I to S, and C5 at I to S, and C4, and C3, and C2, and C1, all I to S, guess what I'm going to do? Is I'm going to keep that tension coming up on those postural muscles and lifting and creating tensegral biomechanics and opening, okay? Everything I to S, I to S, I to S, I to S, okay? And at the same time, at C1, I'm creating that bend point and coming up to it and protecting the neck. So that line of drive protects the neck, and getting up to C1 also protects the neck. But also look what happens at C1. That is the place that I am able to go S to I. And what does that do? That bends that head and lifts the head up. My head, when I do this, the head lifts up. I'm not telling you to do it that way yet, okay? I'm just telling you what happens. So as I come in, I create a bend point and a leverage point, a shearing right through here. This head rises, it rises up, okay? And the forces from here come all the way up, and I'm able to bring all the forces around. So right side release here, okay? Protecting the neck, and the S to I here, allowing forces to give me that left side release. Right side, left side, up, down, and guess what's left? Anterior and posterior. Okay. So the neck is just like a can, and you could just spin the can. Okay? I turn it anterior, I turn it posterior, and I check rotations. Very simple. So those are the three ways that I change directions. And I can do that in the cervicals. The fact that the cervicals are a high tensegral balloon system and everything is pulled upward to it. I know that C7 is my best attachment. I know I want to brace the system so I can create a nice span between the head and shoulders. So I brace temporally where I used to brace on the mastoid, but that created too short of a span. I want to create a nice long span that's easier on the body. Long span, easier on the body. Okay? Follow the articulations. Know my endpoint based on what I want to do as far as the neck, and then knowing the line of drive so that I protect the neck and I release the postural muscles on both sides. And then turning the rotation as I'm going through it. So not just I to S, but say I to S and A to P, following the path. What we got to do. Okay. So, where'd my picture go? So, everything has a bend point. Okay. And those, understanding those tensegral mechanics up in that area and in the cervicals before you even get going is crucial. When you lay somebody down, you need to know where the neck is. You need to know how to set them up. You need to be able to get its attention. And then you have to be able to, once you understand these biomechanics, then you got to be able to do something that is not from your head, not the biomechanics. It turns over into your hand. Okay? And following that tension line, grabbing that tension line, that's like a rubber band that's short, no different than that arm that's coming out of a cast, is you grab that, say, that forearm, and you start opening it. And you open it and you follow the path. And you can't do it hard. Okay? Because the nervous system, what is the human body? It's just a nervous system. It reacts to everything. So if you're abrasive with it, it's just going to lock up further. So understanding these mechanics and understanding the paths and the articulations and understanding how to work with the body and having all the rights and the lefts and the ups and the downs and the forwards and the backwards coming in all together, coming orthogonal, keeps the nervous system cool. Okay? And you get to be able to chip away and feel that tension release. And that's a difficult job. Okay, that's difficult because you have to be able to match the frequency. That's a whole nother job. This is the easiest part, the biomechanics. The harder part is, overcoming that tension, doing it. All right. But that is the space that if you can overcome the person, they don't just go, my back feels better. Okay. You change things on them. All right. You change things. All right, they know that. I know I had this guy came in, I adjusted him really well on the first visit, and I just knew I just changed him. Okay, the second and third visit were not as good, and I said to him, hey man, this was not as good. This visit, you're not going to get the same thing out of this. And why was that? I don't know. I don't know. I blame it on me. I sucked that day. I don't know what it was. The third day, too, I had another sucky day. Didn't work as well. I could feel that. I didn't have to measure it. I could feel it. I couldn't get through the way that I wanted. Okay? I saw him yesterday, and I said, this is better. I said, it's not as good as one, but it's good to go, man. And he will. He'll do better. All right? So beyond the biomechanics become the feeling and the feeling and the releasing. Okay. And that's really the space where chiropractic um, still has a good grip on. I think we're still touchy-feely people on. Okay. And that's where that magic comes from. Okay. I don't think we need to do it and blast somebody and pop them open. I think we need to do it gently, but it takes a mountain of power. I don't mean that you get to just tap somebody like you're tapping them on the shoulder and think like that's light. I don't mean light like that. I need more power than you can generate with the whole mass of your body, your whole arm strength, okay, a low table, everything you got, but the patient never sees it or feels it too much. They feel you getting it to the end and the bottom point, okay, stretching it a little bit further. Yeah, and you hear it, okay? That's the space where you can expand them. And this is what happened. This guy changed. This is 4 days. Guy flew in, and in 4 days, this happened. Look at the pelvic rotation at the bottom. Look at how that pelvis is opened up. Is it perfect? No, but he went from 40 pounds and rotation of 9 and 10 to a right 2 and an anterior 1 and an anterior 1, and 80% of his symptomology was better.
That's the guy in the T-shirt?
There's the guy in the
Yeah,
underwear.
with the shirt off? Yeah.
Yeah.
Oh, he looks good. He's dressed better, too.
Yeah, but, some changes have to occur, Yeah. So, when you get a chance, you look at this x-ray, look at his left trap compared to his right trap, blow that up. Okay, and just look at some of the musculature that goes on and show your patients that if you're taking x-rays, you'll see huge differences in the muscles along the jawline. People have TN and through the neck, and it's all this musculature of the upper part of the body trying to hold the lower part of the body from falling over. Okay. Any
Hey,
questions?
Russell?
Yeah, buddy.
Do you find that sometimes you gotta lift up the hip before you can get into the neck, before you can release the neck up, or is it always you gotta release the neck before you can get to the hips?
I couldn't answer that question. I can tell you that I take what I can get.
Mm-hmm.
So I'll put my hands down on somebody, and wherever it starts moving away, it starts moving. But the majority of my work to get things open is C7 through C5.
Mm-hmm.
Okay. To unlock it, I use that head up there in C1 and bend that sucker and do whatever I got to do if I have to. But I don't know if I can answer that question. I just try to feel things releasing, and I usually just take whatever I can get. I'm not as picky as I'd like to be. I wish I could go, well, I'll start here and I'll do this and do this. The body is not that generous to me most of the time. I just got to get in, take what I got, chip away, chip away. All of a sudden, I start getting some motion. I reposition, push my thumb down, take them to the limit, drive my piezoform, boom, 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 stop, push my thumb down, reposition them, taking that to an end point. I'm constantly resetting the patient to an end point until the whole thing just gives out. And then I used to say I win. Now I say they win. You know what I mean? Like I got it kind of thing. I
Yeah.
used to say I win. Now it's they win.
Mm-hmm.
Yeah. I mean, people just go, yeah, yeah, that's it. I mean, I feel better. And it's not just with their, and I don't mean it when I say that with their pain point. I'm talking about their well-being. And that's not you don't get that on everybody, but you get it. I mean, the more I'm able to overcome the lock, the more I understand the tensegrity system and how to access, all this short and how to get it and position it and me to be able to hit it as well as possible and move it along. When I say hit it, I mean like hit the baseball. Um, they do better. They do a lot better. They get better. They hold better. Um, but holding for me is not what it doesn't hold the water that it used to have. As I teach my patients that there's 3 levels of care, okay, of where they are, and at some time and all through their life they go through these different parts of care because everybody stubs their toe. You know, and sometimes you need once a week, and sometimes you need every other week, and sometimes you need once a month. It's the way it is, you know. And when they come in, you want to see them holding some of this stuff if they can, and then reporting in that they've done nicely. And then, you know, they say, well, what's my numbers? And I said, well, your twist is, you know, X, and your weight's this. And they go, well, that's not good. And I said, well, yeah, but you're feeling good, and that's what you're here for, is to make sure your body's saying symptomatically it doesn't notice it yet. And that's what I'm here for. It's beautiful, you know? So,
One more question.
yep.
I'm about when I'm working on C7, T1, I'm finding, I don't know about you, that sometimes it's really helpful